Researchers at the Institute for Global Health and Development at Queen Margaret University have a long-standing research with refugee populations in Scotland, the UK, and across the world. As part of our work, we developed a framework of indicators of integration that has been used by policymakers and also academics in different contexts. This work puts a lot of emphasis on the key role of social connections, not only for refugees to develop a sense of belonging, but also in terms of accessing rights, services, and living independently in their country of the reception. In order to understand further this work, we also have developed a social connection mapping tools. It's a mixed method methodology that includes participatory workshops and a survey that allow us to understand more the role of these social connections and to assess with a wider beneficiary population the level of connection, trust and reciprocity that they have with different service providers, interpersonal connections, but also other people that they meet in the place of settlement.
Integration is a relational, multi-directional process. So in this light, relationships with formal service providers, such as kind of NGOs or third sector organizations, they're critical in enabling refugees to start their integration journeys. And these kinds of formal relationships are important even before people are officially recognized as refugees. They kind of set the starting point, as it were. But also informal relationships, more kind of personal relationships, are also very important because they help mediate further points like access to education and eventually employment and that sort of thing. From the kind of the systemic side of things, we found that delays to benefits payments or kind of housing allocations, these tend to kind of hold people back in their integration journeys, and so any kind of improvement would really be welcome. So beyond the kind of the systemic, so these things that ideally would be great if kind of systemically they could improve, we found that some of the most important things for refugees are just simple stuff like a neighbor giving a random smile. These kinds of acts of everyday kindness are, they really help foster an environment that's conducive to integration. And ultimately, and perhaps most importantly, what we found is that, and this shouldn't be any surprise as well, is that refugees just want to be normal people.
More recently, we have expanded Dr. Alice Strang's initial work on the indicators of integration and tried to implement this theory to practice. That's why the team has been working on the social connection mapping tools. The tool not only addresses specific research needs, but also responds to the increasing needs of evidence-based policy. For example, some of our colleagues are working and explore the access to health of refugees in the Republic Democratic of Congo, but also in Somalia in the context of Africa. Closer to home, other of our team is working on understanding how the social connection mapping tool can be implemented into practice, how service providers can use the tool in order to facilitate the interaction with the refugee population and help them to plan the pathway of integration, not only during the time that they're working together, but actually after they left the service. Other of our projects have been working on understanding the impacts of COVID-19 and the experiences of isolation of some of the refugee population in Scotland. The impact of the work that Queen Margaret University researchers have done with the indicators of integration and also with the social connection mapping tool doesn't stop here. Our research continues in different contexts with service providers, with the governments, but also with refugee communities in Scotland and the UK and across the world. Our aim is that the better understanding of social connections allow us really to create better conditions for the integration of refugees, to allow them to have a sense of belonging in the communities that they arrive, to create better connections between the welcome communities, the refugees, and all the other stakeholders that take part in this process. The ultimate goal is that we can create more cohesive societies, but also that refugee population can live a better life.